Well, the South African Council of Churches says government must negotiate with Big Pharma for a discount on the COVID-19 vaccine. It further says this will ensure that everyone can have access. The council says companies must be told to put lives before profit. But let's discuss this with the SACC's Reverend Mzwandile Molo. Reverend, thank you so much for your time and a warm good morning to you. I mean, your reaction just at the backdrop of Health Minister Dr. Willem Keys, of course, making that briefing to South Africa about a rollout plan. Are you confident that this rollout vaccine plan will be effective?
Good morning to me and to your viewers. The South African Council of Churches received the presentation by the Minister of Health of the coronavirus rollout strategy with a sense of relief. There's no gainsaying the fact that it is indeed overdue, and the nation needed to be taken into confidence as to what government plans to do with the rollout in the context of giving our people the vaccine. We want to believe that government has the best intentions in mind to roll out this, but we firmly believe that government cannot do this alone, and government has to work with society, such as society acts in its own interest to make sure that the rollout of the vaccine is that which makes it accessible to the most vulnerable, to those who are poor, and to those who need it most. And that demands, therefore, of government not only to tell the nation of what it is intending to do, but to do everything in its power to shorten the time for people to get the vaccine. And therefore, government has to take us all into confidence in a much more intent way to make sure that we all act together to give our people the best defense that we have against this virus, and that is the vaccine.
Well, I mean, Reverend, the SACC standpoint is quite clear. Access has to be, government priority as far as the vulnerable, the poor are concerned. Are there any concerns from your organization that perhaps even Big Pharma may put profits before lives?
Indeed, we do have that concern, because for the SACC, we thank God for the discovery and the dedication that scientists have done in giving of themselves, their brains, their time, their ingenuity, and all those things that come with working hard into creating and discovering a vaccine. We are also alert to the fact that big pharmaceutical companies have got a moral responsibility that transcends beyond their ability to make more money, but to preserve life. And we believe as the SACC, this vaccine moment is a vaccine moment for public good. It's a moment that we can all say to each other, we are putting each other's lives higher than the ability to make money out of our plight. And we as the SACC are calling on government to work very hard and engage those pharmaceuticals to create private and public partnerships that are going to make sure that the vaccine is not a place of exploitation, but is a place of life enhancement for our people. Directly to the pharmaceutical companies, we're simply asking them to rise above the issue of making sure that they have money. Our view is, when they look at their balance sheet at the time we have overcome this virus that is attacking us, they are not going to count only the billions in the banks, but they are going to count the millions of lives that have been saved, and those who invest in them. Right. I hope they are going to look back and say to themselves, actually, our greatest value to society is our ability to save lives, not the ability to make more money.
Well, Reverend, I'm sure you can agree with me that on the other hand, in as much as, vaccines are being advocated for, there's still a lot of resistance from some South Africans saying they will not take the vaccine, even if it is provided. It seems they're quite fearful and anxious that, their health might be at risk, the vaccine may not be good for them, or there might be conspiracy theories and an ill intention behind these vaccines. We've also just, in the past few, at least weeks, saw that prayer by even the Chief Justice, Mogoeng, saying that if there is a vaccine that is intended for ill will, then his prayer was that it should not succeed with that ill intention. Is there the same sense within the church community where some are also saying that they're not necessarily in support of a vaccine?
The reality is, to me, that we as a society, and I think the world at large, is living with a little bit of skepticism that informs the things that we receive as society. And we do not blame people, because the history sometimes indicates that people have been exploited. But the truth is, we must all hold our hands together. The media, churches like we have, those in business, those in government, to have a serious strategical intervention of informing our people as best as we can, educating them, giving them all the information that they need so that our people can make the best informed decisions about their lives. Because we believe the vaccine is a gift that comes from God that allows us to fight this virus in a way that will make a serious dent in its ability to spread. We still continue to call on our people to do those non-pharmaceutical interventions that we all must continue to doing. Washing of our hands, wearing of our masks, social distancing, avoiding big places where we are gathered in many places, and sticking to the rules, making sure that our funerals are done in a manner that is life-enhancing, so that those people who come to funerals don't live with death, but they come to support us and give us all that we need, so that when we go through the trauma of the loss we've already had, we don't leave the secondary trauma of believing those who came to be with us in our funerals are dying because of where they went with us. In that instance, we need to work together to inform our people as best as we can. And I believe South Africans are intelligent enough with good information to make a decision that informs their life in a way that enhances them and enhances that life rather than compromise it. I do not want us to go into some debates that I do not think will help us as a nation to fight this virus.
We'll have to leave it there, but thank you so much for talking to me, Reverend Nzwandile Molo.